This is Take Charge Your Health with Corinne Furnari, Clinical Nutritionist, Physician Assistant, and Carol Peterson, Pharmacist. Listen, learn, and I hope you enjoy the show. Bye!
Welcome back. This is Take Charge of Your Health with Corinne Furnari, Clinical Nutritionist and Physician Assistant, and my co-host, Carol Peterson, Pharmacist. Every week, we present you with new and creative ways to help you make sense of health information and bring it home to you and your family. With years of clinical experience between us and research into traditional and cutting-edge technologies, we give you practical information to help you take charge of your health. This is a pre-recorded program. Carol's going to be going away this week and coming back with more information to share with us, which is kind of exciting. I always find that very exciting. So we're pre-recording the show. Therefore, we won't be taking calls this week. So our show is chock full of information, lots of good information. So stick around, listen, learn, and also, even if it doesn't apply to you, stay curious because there's a lot of good information here. Go on, Carol.
Oh, and we will be putting it on our YouTube channel, Take Charge of Your Health Radio, and that will be posted at our regular time. And you can also leave questions there. If you have any questions and want to communicate with us, just leave a question there.
You just typed it right in.
Yeah.
Welcome back. Welcome back. I'm here with my co-host,
Carol Peterson.
And we're here to explore a very important, essential condition and also problem that we have as a society. But it's also worldwide what we're seeing. So what we wanted to do is we wanted to start out by looking at birth control and how it affects our body. What are the different methods available? What is good? What isn't good? Remember, birth control pill is a societal chemical experiment for 60 years that now we're finding and we're understanding it changes the affect and physical desire of the woman. It changes her energy in relating to the world. It changes her thyroid. It changes her hormone and her hormone base. It changes her physiology. It changes her desire for children. It changes her libido. I mean, it is ubiquitous. How does it get more complete than that? And it goes on. It also changes her bone structure and her bone strength, depending on her dietary habits. It's extreme. But it does change it. It goes on and on. So
I was just reading a little chapter from an old book, and the author was talking about chronic fatigue and the impact of candida overgrowth. And he said, this didn't used to be a problem, not since it started in the 1960s, and what became more and more prevalent was birth control pills and abundant antibiotic use, leading to a whole disaffected microbiome with lots of candida problems, which in turn really alter your hormones. So you made a long list of kind of the negatives of the chemical birth control methods because of the not only societal changes we've seen, but we also see personal changes in the biochemistry of each and every woman. And if I remember correctly, I think we found like 80% of the women in the U.S. have used birth control pills the chemical ones at some time or another. Corinne?
And it has had a tremendous effect on our society. And now we're just beginning to understand the degree of the effect that it's had on our society. So, with that said, and an understanding of how the the pill and the manipulation of our hormones is changing our entire life, we want to look at the options because we really do want to understand that there are options that maybe don't have to make such a great change.
Our mental ability. Some of these hormones can actually interfere in how your neurosteroids work in your brain. I think you were trying to get to that point. So
Exactly.
we have some other things, and first of all, abstinence.
Well, that works
That works.
every time.
I do remember seeing at one point there was a movement to encourage abstinence and teach it in high schools. And I think these days we're more apt to learn about young girls going to OBGYN and getting their first pack of birth control pills is probably the norm. Um, Not only for birth control, parents are worried about children's sexuality, but also other things like acne improves with birth control. And if you're already showing signs of PCOS or having severe menstrual cramping, rather than get to the root cause, you're very apt to get a birth control pill prescription. How about
And
withdrawal?
or an
And
antidepressant,
oh yeah, that too.
birth control plus antidepressant for how badly you feel because your hormones are so dysregulated and you feel horrible. So you get addicted to two things, to two pills that become long term in your life.
Yeah. And really disrupt your body over the long term. Then there's withdrawal. How successful is that?
Not
That's
very
very true.
successful. If you believe that, I've got a bridge that's for sale. Really good price, very available. But withdrawal is not a dependable way because there's two reasons why it's not dependable. One is that part of the lubricant that is released from the male has sperm in it. So here you are having intercourse, he's holding back, but sperm is being released in small amounts, but in very fertile people, it's enough.
All you need
And
is one.
all you need is one and one, exactly. And so there you have it. And but then young people and many people can get overexcited and can't control the release. So there you are. You have a double hit on goal, which is which is the sperm into the ovum
Yep, on its way. So
on its way.
we have calendar methods. I seem to remember my mom having one of these. She also had five children, so I don't know if that was successful or not. I never had the chance to ask her. But we
In
do have changes in cervical mucus that we
can
sometimes
look at.
monitor. Yep. And basal body temperature, so you can see when you ovulate. We have apps
Yeah.
for all of this now, you don't have to have paper and pencil and graphs. We can do it on our smartphones. What about these? I do hear about people using some of these.
Well,
Particularly, you can actually test hormones with an app and some strips, and it will tell you if you have ovulated or not.
uh-huh. No, I have not used those, but calendars it's interesting because with German people, there were studies done in the 80s or 90s that the calendar method was as effective as the birth control pill. But that's with a very structured society, very structured, very controlled society. With Latinos, it was totally ineffective. So it depends on the culture that you're dealing with that that can work or not work. Now, you brought up something else. Now, I'm not familiar with the apps, so you're going to have to teach me that. But the mucus, the feeling of the mucus, whether
Mm-hmm.
it's
Sticky or not?
mucoid
Yeah.
or kind of a little grainy, that takes a knowledge of your body and a willingness to touch yourself, which in the 60s, women were willing to. And then as time went on, people I would see women say, "Ooh, how horrible. Ooh, I don't want to," so they were totally out of touch with their bodies,
Oh, yeah.
completely out of touch. I remember in the 70s, there used to be groups where they'd use speculums, the groups, and each people would look at their uterus, their cervix, and see what it looks like and touch themselves and whatever. And what is it? What was it called? Our bodies, ourselves? What
Yeah,
there was
that I think
the
that was
book,
it. I picture that book. It was
big, thick book,
a big, thick, was it yellow? I think it was yellow cover.
and which taught women, it was a book related to women about themselves and how to relate to themselves and how to see themselves and how to touch themselves so that they could be in tune with their cycle. Now, I don't know. You're going to have to be a little clear with me about because I'm behind on this one,
Oh,
about the
oh,
apps available.
yeah, this app tests for an estrogen metabolite, a progesterone metabolite, and I think LH, which goes up at ovulation to pituitary hormone to induce ovulation. So women who are using this can very successfully see where they have ovulated or not. And I'm seeing some use for that app and the testing used in perimenopause because it starts getting confusing whether you've ovulated or not. You can actually have bleeding in a cycle that has no
No
ovulation.
ovulation at
So
all.
you can't really tell. So
Hmm.
I see some application for that, but of course, it's a nice tool if you are wanting to get pregnant and to verify that ovulation has indeed taken place. So it's quite interesting that this is available to us now. So where were we? You were just passing it on to me, and I forgot where we were.
We were
Okay.
finishing up with the apps available to
Uh-huh.
help us understand our cycles. And in a perimenopausal cycle, you can have bleeding, you can have a menses, a period, but not have ovulation at all. But then at the same time, you can be irregular in your bleeding and be having ovulation also. So that's why some people in their perimenopausal period think that, well, I haven't had a period, so I don't have to worry. It's all over for me, and they end up pregnant.
Mm-hmm.
So you always want to understand that there's both possibilities there.
Oh, it sure is. I've experienced women who are diagnosed with premature menopause, starting on hormones and starting to cycle again. So, never say never, right?
Cycle with ovulation?
Yes, yes.
Oh, wow. Okay.
And Ray Peat had this example in one of his newsletters or books. He said, I believe I have it somewhat correct, a 50-year-old woman who had been diagnosed with premature menopause in her late 30s met and married a younger man. At the age of 52 and 53, she had children.
Oh, that's interesting. I had a case of a woman who was in had a child when she was like 17. So it was a premature birth. And then she went through different phases and had a couple of different sexually transmitted diseases, which scarred her fallopian tubes.
Mhm.
And she got together with her husband. She had a stable life for 25 years and they could never get pregnant. And it was a real disappointment in their life. So they separated. This wasn't the reason for the separation. It was
Just
many reasons. So they separated, and she called me up and she said, one weekend with this younger man, with a sailor.
a sailor.
Spent a weekend with a sailor, and she was pregnant in her late 40s, early 50s, and she hadn't had a period in months and months. But it's amazing what strong sperm can do. So
And
we're going to be talking
all,
we're
all
going to
those,
we're
we're
going
going
to
to
be
be talking
talking
about the
about
flip
that
coin
later
too.
in the show and how to create and evaluate strong sperm and what you do for it. So
Okay,
go
so
on. What
let's go
else is another birth control method,
barrier
Carol?
methods, condoms, and cervical caps, diaphragms. Those two you have to get measured in a doctor's office to have the appropriate size. They have sponges. With those diaphragms, you often are recommended to use a spermicide. And I think, if I remember the chemical correctly, it was like nonoxyl 9. And I don't know
Minoxidil
if that's
9.
the, yeah, I don't know if that's the nicest thing to be using. However, I remember reading way back when that the diaphragm really had quite a lot of success at preventing pregnancy, although the statistics didn't bear it out because they also counted among those diaphragm users those women who didn't get it out of the drawer. So then its usefulness went down to about 70%. So if you use it, it's actually quite good. Both condoms and diaphragms, or using both, can be quite
Well,
effective.
if the diaphragm is in the drawer, it's still effective. The drawer never got pregnant.
Ah.
And that's that's what I used to tell my patients. If you
Yeah, it was
don't want the drawer to get pregnant, keep your condom in the drawer.
it's pretty good at
Your
keeping away
condom,
elephants too.
what? And white elephants
Yeah,
also,
yeah.
or your diaphragm in the drawer. I always now diaphragms are easier to fit. I used to fit diaphragms with patients. You just have to be willing to touch yourself.
Hmm.
You put the cream in the center and insert it. But your cervix isn't straight up. Your cervix can be there, can be faced, facing forward, but in the back of the vaginal opening. And so you have to be able to know to feel your cervix and insert the diaphragm over the os, the end of the cervix. And then the cream creates a suction, almost like a vacuum, and it blocks the sperm. So you put it in before you have intercourse. You really shouldn't feel it if it's put in correctly
Hmm.
and if it's measured correctly also.
And cervical caps, were you measuring for those too? Did you
Oh,
have
yes.
occasion?
I loved those the best. Those were the best. They have an interesting history in that they were created for workers in England, women, so that they would be inserted so women could be working on regular schedules and not flowing blood. So they weren't created for conception. They were created to interfere with the release of the menses so women could work full days without whatever.
Huh.
Well, then they realized that it could be used for conception, and a cream was created. Now, this is more difficult and has to be one inserted more sensitively. You have to be able to feel the cervix because it's much smaller. The
Mhm.
diaphragm is larger. There's one mistake on the diaphragm that people make when they're inserting them. They make them too large because they think that the reason why they work is because they're blocking the sperm from moving up the canal.
Mhm.
But that's not really true because at the time of orgasm, the canal balloons and so it spasms, open and close and open and close. So that spasm allows the sperm, actually assists the sperm to go up deeper and surround the cervix. So creating a diaphragm that's very large and uncomfortable for the woman to wear does
Hmm.
not prevent the conception. It's better to have a diaphragm that fits you comfortably and then have the cream in there. So the cream is the barrier and creating the block, and the diaphragm supports the cream. So is the cervical cap, but the cervical cap is small and the cervix is also small. So you have to be willing to touch yourself and feel your cervix, put the cream in the little cup and insert it and put it directly over the cervix. Now you have to feel for it. So I used to fit it on a woman and then I would leave the room. Well, then I would take it out.
Mhm.
Then I would leave the room and I'd say, Here, now you do it by yourself. Get in whatever position you need to insert it. Put the cream in, insert it, and then I'll come in and check it and see that it's in the right place. Because it could be in that vaginal canal without being over the cervix if you're not inserting it correctly. So it takes a little practice, but it is as effective as the pill. The diaphragm is very effective when used. It's in the high 89, 90%. But if you're using the cervical cap, you have equivalent to the birth control pill in terms of barrier protection. Now, I never liked the Naloxone 9 either. And this was when I used to go to lots of conferences in Germany and the
Mhm.
Netherlands and whatever. There was a cream that a pharmacist was making over there that was completely non-toxic. And we would have him send it over to the patient directly, and she would use it, and it was an herbal cream that he was using as a barrier cream that was non-toxic to the woman. It was made of herbs and good oils, and it was quite delicious,
Quite
and
nice.
women really enjoyed it.
Well,
Not
then,
delicious, but really
uh,
luscious in its in the way it felt. It was very smooth and comforting and
well, let's talk about condoms for a minute. So there's an old history with this. They used to use animal intestines or linen, and finally moved to rubber and
Somehow I don't think
latex.
linen would be very good.
No, somehow I don't either. But those animal intestines, I can verify
Could be good.
could be good. When I was starting out my career in pharmacy, there were condoms, I forget what they were called, 4X or something. They were actually sheepskins or sheep intestines, and they actually were quite popular. I think it retains some sensitivity that sometimes men complain about with condoms. I remember having a shortage of those 4X condoms going on in our pharmacy, and a salesman came along. I said, "What's happening?" And he said they had a disaster. They were being manufactured in Puerto Rico, and somebody was supposed to come in on Sunday and take them out of their enzyme bath and rinse them off, and didn't show up. So that critical person was the cause of these condoms being sold, and they were not sturdy enough to last and do the job. They had some big recalls. So I just
Oops.
just a little bit of
Oops.
history there. But for
Well,
the most part, I think latex, I don't know if they're still available, but the latex condoms really have taken over, and they're also considered helpful, and they block transmission of sexual transmitted diseases. So it has some, I think it has a very good rate of success as long as they're used.
now let's go to the pills and the other um, procedures that are available for women. And let's talk about the positives and the negatives, but let's kind of go through them quickly because I want to talk a little bit about fertility, but I want to look at it from the other side, a side we don't often look at. So let's talk about what else is available for birth control.
Okay, well, now we get into the chemical types, the birth control pills. There's a patch you can get for birth control with both a synthetic estrogen, synthetic progestin. There's a vaginal ring. There's progestin-only pills, continuous
The
combined.
vaginal ring is what made
It's
of?
synthetics. These are all synthetic analogs of our normal hormones. And
Okay.
so they tend to block your production of your hormones. Remember last week we were talking about you had measured somebody's hormones when they
Oh,
were on the
yes.
pill, and we can't actually measure directly the synthetics, but you can measure what the person is able to put out. And they have levels like a menopausal woman, even though when they're very young. There's so much suppression of your body's ability to make hormones. So this birth control pills were really championed by Margaret Sanger and Catherine McCormick, who started Planned Parenthood. And they were very much behind that, backing finding synthetic hormones that would serve as birth control. I'd like to insert a little interesting thing. You know, we talk about men and they don't participate in birth control. But if men do use testosterone, if they've gotten to a place where their testosterone is low, and they use testosterone, whether it's creams, gels, injectable pellets, all of these testosterone therapies suppress LH from your pituitary. There's supposed to be a rhythm here. You get surges of testosterone, and as it comes down your pituitary, surges LH. And this is absolutely essential for conception. So if any of those forms of testosterone are being used, these men cannot father a child. They actually have to get off the testosterone while they and their partner are trying to conceive. This may not be the same. I'm working with a company that has a sublingual serum, and there is an FDA-approved product with intranasal testosterone. These testosterones are very short-acting, go up in the serum and drop back, and that LH surge is still there. That still comes up, so you have that particular rhythm is still kept up. So for men who do need some testosterone and they're interested in having children, they probably should look into these forms of testosterone.
Well, yeah, much more so, without a doubt. But there's also other things that they can do that are low in testosterone, men that are low in testosterone that I want to be talking about. Because whenever we think of, I'm going to switch over, I guess.
Okay.
Whenever we think of infertility, we think of the woman, and it's always directed toward the woman. But yet, um, but yet, that's really not always the case. You know, it's a 50-50, which makes 100%. And without looking at the male and what is happening to our males, we're not getting the whole picture. And so today I wanted to look at the male and look at more of the whole picture and what we're facing in the fact that sperm count has gone down 62% since the 1970s. 62%. That's so dramatic. Testosterone gone down over 50%. So what is happening there, and how can, at that low amount, how can males feel well? And
Well,
how can they conceive?
they
We're
don't.
we're dealing what?
They
Many
don't feel
don't.
well.
And
Yeah.
very often what we're dealing with is the fact that we're dealing with the fact that uh, that um, uh, the focus is always on the woman for the infertility. But I think we really have to look at both sides of the picture. We have to understand the sperm. The sperm, it takes literally 90 days to form a sperm. And in that period of time, these 90 days before they conceive, what happens is at any point as it's developing, at any point, there can be damage. So, what you have is a reduced sperm count and a lifestyle that can create dramatic damage and reduce motility on the existing sperm. So, so what we want to do is we want to look at what we can do and what can males do to protect themselves and keep themselves healthy so that their sperm develops and they become a healthy partner for for as a mate. So with that understanding, you know, how often are men drinking? How men go out weekends and drink heavily, they drink, and what happens to the sperm when people are drinking heavily? Has anybody thought of that?
Well,
You
somebody
know,
has. You're going to tell us.
I think I'm going to tell you. It can be very damaging to the DNA, and it it can be very damaging to the DNA. The one alcohol, alcohol lowers testosterone levels, but it also can damage the DNA of the sperm. So you've got a double effect there. And, you know, cannabis, there's no effect with cannabis. Everything's wonderful with cannabis. Well, they're finding DNA changes on the sperm that happen in the early stages. You know, in the beginning, you have the beginning formation of the sperm. And what happens is then it goes into the body and then it goes into the tail. And each part of the sperm has different functions. Well, particularly in the early part, when the sperm is just forming, cannabis can be very affected, can affect the
The sperm
the sperm
quality.
quality. So there's also a motility problem that we're seeing. So, Carol, you have any thoughts on how to deal with building sperm?
Oh, there. First of all, you've got to build a healthy body. You sent some material over, and you kind of alluded it that there's a preconception trimester, 90
Trimester.
days. Yeah,
Mm-hmm.
the 90 days. And so when you want healthy sperm, that's when they're starting to develop in those 90 days prior to conception. The same thing actually happens in women. The egg that will be released is
Also,
already getting chosen and prepared 90 days ahead of
90
time.
days.
What
It's
a
both of them.
fascinating
Amazing, isn't it?
it's fascinating situation. So, one of the things I'd like to point out before we get off the alcohol is I know for sure that alcohol, red wine in particular, they showed a huge rise in estrogen with just one drink of red wine. And that's big enough to really mess up somebody in perimenopause, I can tell you. But this will also be happening in men too. They'll have an estrogenic effect from some of the alcohols. And then particularly if you have beer that has been fermented with hops, hops is very estrogenic. And so this is opposing your testosterone. It actually will work through sex hormone binding globulin. Estrogens of any sort increase this carrier protein, which hangs on to the androgens more tightly. So DHEA, testosterone, dihydrotestosterone, even though you might have some okay blood levels of these, in actuality, if it's not so available, it's to you, you're not going to be able to create sperm like you could. You do need a little bit of estrogen. Men need some estrogen. And there's been, when men are prescribed testosterone because their testosterone is low, sometimes they're given an aromatase inhibitor. And these are chemicals which stop the conversion of testosterone to
The
estrogen.
estrogen.
All estrogen comes through testosterone. So in doing that, they've actually over aromatization blocking men, and they don't have enough estrogen in order to create sperm. You do need estrogen, and I feel like we need to stick to the natural aromatase inhibitor that our bodies produce, and that's progesterone, one of my favorite hormones. Just
And where it's a full circle.
go,
So
just
we've gone from 50 to 60% decline in sperm counts since the 70s. And why? Well, we're looking at toxins, we're looking at heat, we're looking at lifestyle. But what about finasteride? That's an medicine that's given regularly because young men are losing their hair. So they're given finasteride, which blocks dihydroepitestosterone, which is a more inflammatory form of testosterone. Well, with that being blocked, what happens? It interferes with the fetal development. So it's a very dangerous drug to be taking if you are wanting to conceive. And it takes 3 months. It takes that preconception period to make sure it's washed out of your system. You can't say, oh, well, I've been off a week. You want to remove it for 3 months. The
The,
risk with animal studies show exposure can lead to birth defects in male offsprings. So that's not what you want to do. And so topical minoxidil, which also has a hair growth effect, does not have that same effect. So switching from finasteride to topical minoxidil might not create the same effect. So the
this is
modic
a this is a thing I'd like to put out there because I was kind of stunned when I heard it in a lecture. We have so many young men who are prematurely balding. And do you remember when you were much younger, you used to see balding men and they'd have all these comb overs? And
uh-huh.
and if a big wind would come along, push, would go their comb overs. And that used to be the thing that they did. But as I recall, these were older men who were having trouble growing hair. And now we see young men in their 20s and 30s. And unfortunately, this is a red flag for metabolic syndrome, insulin resistance. And these poor young men aren't really getting diagnosed. If they, most of them will just cope and shave their heads and say, I'll go, this is trendy. I'll put an earring in my ear and shave my head. Or, and it's very acceptable in our society now. But it's such a red flag for insulin resistance that you really should, at that point, check into fasting glucose, fasting insulin, triglycerides, and shift your metabolism because you are in a metabolism that is already counting down your years if you leave yourself in this situation. So, young balding men, this is a red flag that insulin resistance is already there, and you can turn this whole thing around. And whether it's going to grow back your hair or not, I don't know. I don't see enough data, but there is a chance that you could. So that has to be a primary where the hair situation is. And when you have metabolic syndrome, those high insulin levels is also going to contribute to infertility. Your testosterone, your available testosterone is simply not going to work as well. The
So
receptors will not be working as well.
exactly. So, what we're talking about is we want to, one, I'm going to go through a little list, reduce our toxic load, males and females, in any way that we can. We want to eliminate endocrine disruptors. And what is that? That's BPA and phthalates. We want to eliminate, if possible, heavy metals as much as we can. We want to avoid nonsteroidal anti-inflammatories, which are very important in terms of blocking around ovulation or conception time. So you really want
So
to avoid those
those are
at
like
that time.
Advil and Motrin and Naproxen,
And naproxen, all of
all
those.
those. Yep.
Liver support. You want to give your liver some support, which we've been talking about for the last 3 weeks or so. Cruciferous vegetables, hydration, sweating. Now, sweating is good, but too much is not so good for men because you do not want to heat the testes more than the testes are hanging down because they need to be cooler than the body.
That's right. So
And
you should wear boxers rather than the tight-fitting briefs.
exactly. And when you're storing food or when you're bringing food with you, you want to switch to glass and stainless steel, not the plastic. And then the foods you want. You really want foods that have good amounts of zinc and selenium. And what is that? Salmon, Brazil nuts, um, mussels, all of those are very
Oysters.
important. Oysters,
For your
mussels.
single. They say Casanova ate 50 oysters a day.
Well, it
Oh,
worked.
okay.
He's famous. So then we've got zinc and selenium, also omega-3s, natural omega-3s, high quality eggs, uh, and, and a good anti-inflammation dietary protocol. Antioxidants C and E protect DNA from oxidative damage. And walnuts are wonderful also. And for women, we really want them on tetrahydrofolate. We
Yes, not
really,
folic acid.
not folic acid. And for men and women, CoQ10. The ovum needs the CoQ10 for energy, and the sperm needs CoQ10 for energy and sperm motility. We also want zinc and we want a good multivitamin. And both of them need adequate vitamin D, not small amounts, but adequate amounts. With adequate amounts of D, less tendency for the child to become diabetic, and very good for the brain and hormone support, and omega-3 cell membrane health. And then we have fertility. You have to understand it's neuroendocrine. It's a, it's your whole, it's your brain, it's your hypothalamus, and it's your reproductive uh, organs. And so you don't want high cortisol, high stress, because then you're suppressing your own natural hormones that are going to help you with your fertility. When they're too high, they block your hormones, they block your testosterone, and they block reproductive hormones in males and females. And it's very important not to be in a fight or flight, because that deprioritizes within the body
Yeah,
reproduction. And
danger. It's parasympathetic. You've got to be rest and digest, the parasympathetic side of your autonomic nervous system. You've
and
got to
then
be chill.
there's something, melatonin. We talk about it all the time and, sleep, sleep, sleep. But melatonin is a powerful antioxidant for egg quality. We don't think of it that way, but it's very important, and it works within that circadian rhythm to reproduce hormone synthesis. The protocol, 7 to 9 hours of sleep and total darkness blackouts. When people were having trouble getting pregnant, I would get them blackout shades. And for the first half of the month, 3/4 of the month, I would have them use complete and total blackout shades. And then I would have them open up the curtains and then let the full moon shine in as their period came about. And they found that things were much better in terms of their cycle and their ability to sleep. Disrupted circadian rhythms are linked to menstrual irregularities and lower sperm quality. So it's males and females.
I'd like
And,
to I'd like to say a word about progesterone here. I
please.
just saw on Facebook some young woman who's using progesterone to help her with PMS type symptoms was writing about, oh, I have to go down on progesterone before I start trying to get pregnant. And that's absolutely 100% the wrong thing to do. So earlier, when I worked at Women's International, we were using large amounts of progesterone for PMS symptoms, but we also worked with fertility clinics, and the dosing of progesterone was like 400 to 600 milligrams in the luteal phase. And this was in divided doses with oral capsules with the progesterone and oil. And this was quite successful, but you don't stop the progesterone. You start doing that so you can get pregnant during the luteal phase after ovulation. And then you still have to maintain that
To
progesterone
hold the
level
baby.
till the after the first trimester. The placenta kicks in with much more, like 10 times the highest luteal is where you're going to get with this pregnancy levels. However, somebody sent me an article. It was a study done with a fertility clinic using progesterone all the way through the pregnancy and had much better outcomes. And I'm beginning to think that there are optimal levels, or maybe you can have an estrogen dominant pregnancy even and have some issues. Corinne, we're about at the end of our
I see
time.
that.
Wow.
So I want to just give a quick 90-day preconception checklist. So stop hormonal and birth control pills and finasteride. Boom, gone, 90 days minimum. Detox your home, remove the plastics and toxins. Start the big three supplements, and that's a multi, CoQ10, and vitamin D, vitamin K. Month two, build and optimize the Mediterranean diet, just good foods, good vegetables, good cleansing vegetables. Um, Integrate stress management and get good sleep for your brain and also for your whole adrenal system. And then month three, sperm and egg quality optimization. So that's all the nutrients you need. We talked about selenium and zinc. We didn't talk about ashwagandha.
Oh,
Ashwagandha
we
has
can't
been,
go into that. We're out of time.
I'm going to give one more sentence. Ashwagandha has shown to increase sperm over a 3-month period 165%. So that's the way we'll end the show. That's a
Oh,
biggie.
okay. So my website, come and visit, is the Wellness by Design Project. I'm on Facebook and on YouTube with the same name. And we have a Facebook page for this show, Take Charge of Your Health with Corinne and Carol. And Corinne, you want to add your website?
My website is Corinne Health, and pretty easy, Corinne Health. And I also have a Facebook page, and we have shared Facebook and YouTube page. Take Charge of Your Health, radio with Corinne and Carol, and my Facebook page is Corinne Furnari. So we'll be back next week. Thank you so much for
Thank you.
sharing this time with us. We loved it. We love being able to share this information with you. And we'll be back next week live.
Bye.
That's all for this episode of Take Charge of Your Health.
This is Take Charge Your Health with Corinne Furnari, clinical